Well, you may or may not know that the Minnesota House recently passed a bill banning conversion therapy in Minnesota for children and vulnerable adults who identify as LGBTQ+. So in 2021, Minnesota Governor Tim Walz signed an executive order barring any use of state funds to pay for conversion therapy. But the controversial practice hasn't yet been outlawed in Minnesota. That is expected to change as Democrats now control both the House and the Senate. So today we are joined by Dr. Kade Goepferd, who recently testified in support of that bill.
And Dr. Goepferd is the Chief Medical Officer and Medical Director of the Gender Health Program at Children's Minnesota. Dr. Goepferd, thanks for being with us here today.
Absolutely.
I know you're very busy over at that program there too, but also busy at the state capitol, because even though the legislature is now in the hands of the Democrats, there's still a lot of work to be done when it comes to passing this bill.
Absolutely. I think, we know that conversion therapy is something that is harmful for kids. We know it's not really therapy. It's an outdated, discredited practice. But I think now is the time to really send that message to Minnesotans that they deserve access to really good care and therapy.
You had a chance to testify before lawmakers. What was that experience like for you, and what were you hoping that lawmakers came away with after your testimony?
Well, it's really actually an honor and privilege to be able to testify on behalf of my community and behalf of the kids that I care for, to be able to say, we really deserve access to good, high-quality care, and we know that conversion therapy isn't that. So it's nice for me to get a chance to share my medical expertise to say, this isn't really therapy, this is harming kids, this is harming families, and we need to be done with it.
Doctor, we know there are a lot of misconceptions out there about care for young transgender patients, and I'm wondering if you could touch on some of those for us.
Sure, yes, thank you for bringing that up. There is a lot of misinformation and kind of myths out there. At its core, the care that we provide in the Gender Health Program is developmentally appropriate care for kids who are trying to explore and figure out who they are and for their families. Much of what we do is not based in medications or particular treatments, but really in listening to families, helping them navigate school, other family members, things like that.
I'm curious, because we talked about what you want other lawmakers to know. What would you say to other medical professionals who may have some questions about this too?
Sure. I think, either in the case of conversion therapy or in the case of gender affirming care, there's really good medical evidence to say, one, conversion therapy is harmful, and we know that, and two, that gender affirming care is evidence-based, and it really helps kids thrive and do better. So I think really looking to the medical associations and the medical journals that we know and trust to get good, accurate information.
I think there's a lot of parents out there who maybe their children are struggling right now and look to this gender health program that you have, which is quite something here in Minnesota. I remember when you started it there. What do you say to those parents? How can they connect with you, and should this be something that they connect with?
Yeah, I think absolutely. What I tell parents is just think of it as any other specialized care that you would get for your child. So at Children's Minnesota, we're the kid experts in so many things, from cardiology to cancer treatment to asthma care, and gender health care is no different than that. So if you have questions, if you're not sure what to do next, if you're not sure what to say to your child, reach out to us, and we're happy to provide resources and support.
Because it can be overwhelming, for parents and for kids alike. It can be very overwhelming, I'm sure.
Yeah, absolutely. I think as a parent myself, there's a lot of things that our kids throw at us that we don't feel prepared for.
Right.
Yeah.
And I think something like this, while parents may want to be really supportive and love and support their child, sometimes they don't know what that looks like. And we're all so afraid of our kids being hurt or harassed, or worst case scenario, them hurting themselves.
Right.
And so I think what our program gives is parents really a peace of mind to know that there are medical and mental health professionals that can help them.
You clearly spend a lot of time thinking and analyzing transgender healthcare here in Minnesota. What do you hope its future looks like?
Yeah, what I really hope is that we come to view gender affirming care for trans and gender diverse kids and young people just like any other type of evidence-based healthcare. That we leave the science and the care up to doctors and parents and those who really have specialization in it, and that the stigma of being transgender, of being part of the LGBTQ community is removed. And I think back to the ban on conversion therapy, that's a big step in removing that stigma, to say, we don't need to be fixed. There's nothing wrong with us, and we need the ability to thrive.
How does someone reach you if they want to talk with you? Do they just call up Children's and say, I want to talk to the Gender Health Program?
Absolutely. So actually the best way is probably to go on our website, childrensmn.org/genderhealth.
Okay.
And there's an intake number there. You can call the clinic. We have a clinical case coordinator who takes our calls and can help put folks on a waiting list or get us in touch with one of our therapists.
Doctor, thank you so much for joining us and being part of the conversation today.
Yeah, thanks for having me.
And if you want to learn more about Dr. Goepferd's work or follow the bill at the Capitol, you can visit our website, WCCO.com.